Can you explain us what is the main message of your presentation today?
The main message is that alcohol consumed in moderation, including beer, is an overall protective way of living. It belongs to the healthy lifestyle. One should consider alcohol drinking not as a single item, but in the context of dietary habits. And in particular, at least the data we have in our country, in Italy, is related to the benefit of drinking, consuming alcohol in the context of a Mediterranean diet.
What is your overall message on the place for beer in an adult's diet?
Data on beer are less important and conclusive than other beverages such as wine. But more recent data suggest that in moderate amounts, beer and wine gives the same protection against cardiovascular diseases and against all-cause mortality, which is a very important clinical outcome.
Good, thank you. And looking at all-cause mortality practically means looking at all disease combined and then making a balance, right? What are the advantages of this approach?
There is discussion on the diagnosis of different types of cancer, or also on hemorrhagic strokes or ischemic stroke. So sometimes data on non-fatal events are not solid because of uncertainty about the diagnosis. But unfortunately for all of us, there is one thing which is a solid endpoint, and is death. There is no discussion about that. And modifying the risk of death is a very important objective.
And what are the main benefits of moderate beer consumption?
As I mentioned, mainly the reduction of cardiovascular risk. But since cardiovascular diseases are the first cause of morbidity and mortality in our societies, and even in developing societies, and also in the Eastern countries, reducing cardiovascular events is reducing about half of the disease outcomes. And so this is important. We mentioned the total mortality. There is an effect also on the development of diabetes, in the sense that people who drink a moderate amount of beer or alcohol in general develop diabetes less frequently. If they got diabetes for other reasons and they consume alcohol as a treatment of their diabetic diseases, we saw in our population in Italy that there is a reduction of mortality, and that alcohol contributes by about 15% to the overall effect of Mediterranean diet on this endpoint. When I was a student, it was a general rule to say that diabetic people should not consume sugars and alcohol. But now our results say that they should not consume sugar, but they can drink a little bit of alcohol.
And to finalize, what is your overall message on the place for beer in an adult's diet? This question was already made, but if you want to give a final conclusion of what is your message, please.
The final conclusion is that beer, wine, less spirits at the moment, but beer and wine certainly belong to our lifestyle, and we should not forget that they give pleasure. They also contribute to the overall benefit of Mediterranean diet, because alcohol facilitates the absorption of the components of beer or wine, which are called polyphenols, and are very useful substances for vessel wall and for many other situations in our body. So the combination of alcohol with Mediterranean diet is a very successful combination. In Italy, wine consumption is decreasing a little bit and beer consumption is increasing. I think that from a public health point of view, it should not make too much difference, because the benefit on the major event, which is cardiovascular disease, should not be different.